Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about this topic because many people live with it quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. I want you to imagine for a moment that we are sitting together in a quiet clinic room. There is no rush, no loud alarms, just a gentle conversation between you and a doctor who truly wants you to understand your body a little better. Many people I meet feel confused or even discouraged when it comes to blood pressure. They hear numbers, they hear warnings, sometimes they hear fear, but very rarely do they hear calm explanations that help them feel steady and supported. That is what I want to give you today. Blood pressure is something most adults over 40 have checked again and again. A cuff on the arm, a brief pause, two numbers written down, and then life moves on. Many people assume that if no one says anything urgent, then everything must be fine. And often, things are fine. But sometimes, the body is quietly trying to communicate in a softer way. Not with pain, not with drama, just with patterns that can tell us how the heart, the blood vessels, and the rest of the body are coping with time, stress, and daily life. As we get older, our bodies naturally change. Blood vessels that were once very flexible may become a little stiffer. Hormones shift, sleep patterns change, kidneys work a bit differently. None of this means something terrible is happening. It simply means the body is adapting. Blood pressure readings can reflect these changes long before a person feels unwell. That is why understanding them gently, without fear, can be so helpful. Many people focus only on whether their blood pressure is labeled high or low, but blood pressure is not just a label. It is more like a conversation. The top number reflects how much pressure is present when the heart is gently pushing blood forward. The bottom number reflects how much pressure remains when the heart is resting between beats. Together, they tell a story about flow, balance, and resilience inside the body. For many adults, especially those over 50, blood pressure can slowly change without obvious symptoms. You may still walk, cook, care for others, and enjoy your routines. Yet inside, the body may be working a little harder than before. This does not mean danger is around the corner. It simply means awareness can be supportive. One thing that can be helpful is noticing the space between the two numbers. This space can widen as blood vessels become less elastic with age. When vessels are flexible, they absorb pressure smoothly. When they are stiffer, pressure can rise more sharply with each heartbeat. Many people never notice this change because they feel fine. That is why calm understanding matters more than fear. Another gentle point to be aware of is the lower number. When that number becomes very low, especially in people taking several medications, the heart may not receive quite as much steady flow during its resting phase. Many people do not feel this at all. There is often no pain, no warning sign. But over time, balance becomes important. This is not about stopping medications or being afraid of treatment. It is about thoughtful adjustment and conversation with a healthcare provider who listens. There are also times when blood pressure suddenly becomes harder to control after being stable for many years. This can feel frustrating and confusing. Often, people blame themselves. They think they did something wrong. In reality, the body may be responding to changes in the kidneys, hormones, sleep quality, or even long-standing stress. Blood pressure can rise as the body tries to protect itself. Seeing this as information, rather than failure, can help guide gentle investigation. Sleep plays a quiet but powerful role in blood pressure. During deep rest, blood pressure usually softens and lowers slightly, giving the heart and vessels a break. When this does not happen, people may wake feeling tired, foggy, or unrested even after a full night in bed. Frequent nighttime urination, restless sleep, or morning fatigue can sometimes be clues that the body is under strain at night. Paying attention to how you feel, not just what numbers say, is important. Another pattern that deserves gentle attention is large swings in blood pressure from day to day. Some variation is normal. We are not machines. But when readings jump dramatically, The nervous system may be struggling to regulate smoothly. This can happen with dehydration, anxiety, nerve changes, or poor sleep. Over time, steady rhythm is kinder to the brain and the heart than sharp ups and downs. Something many people never think to do is check blood pressure in both arms from time to time. For most people, readings are similar. When there is a consistent difference, it may suggest that blood flow is not equally smooth on both sides. This does not mean panic. It simply means more information can be helpful. Many serious conditions develop quietly, without pain, and early awareness allows for calmer decisions. I want to pause here and speak directly to you. If you have been listening with a little worry in your chest, that is understandable. But please remember, this conversation is not about predicting harm. It is about giving you language to understand your body. Knowledge does not take away peace. It often brings it back. Simple routines can be very supportive. Checking blood pressure at the same times of day, sitting quietly beforehand, and writing numbers down can help patterns become clear. Drinking enough water, moving gently each day, and prioritizing restful sleep all support healthy circulation. These are not dramatic changes, they are small acts of care. Many people also find comfort in slowing down. Gentle walks, calm breathing, reducing constant rushing. The nervous system influences blood pressure more than most people realize. When the body feels safe, numbers often soften naturally. If you take medication, consistency matters. Taking it at the same time each day and sharing how you feel with your doctor helps treatment stay balanced. Medication is not a sign of weakness. It is one tool among many, meant to support the body, not silence it. I also want you to know that feeling fine does not mean you are ignoring something important. Many people live full, joyful lives while managing blood pressure thoughtfully. Awareness does not take away independence. It often protects it. Sometimes people ask why no one explained this to them before. That question makes sense. Healthcare can feel rushed. Conversations can feel brief. But your body deserves more than a quick glance. Taking time to learn empowers you to ask calmer, clearer questions at your next visit. You might gently ask about patterns, about how both numbers work together, about how sleep or stress may be affecting you. These are reasonable questions. They are not confrontational. They are part of caring for yourself. I want to share something important. Aging is not a failure of the body. It is a natural process. Blood pressure changes are not punishments. They are signals. When we listen with curiosity instead of fear, we make better choices. If this conversation has helped you feel more at ease or more informed, I would gently invite you to like this video. It helps this calm, supportive guidance reach more people who may need reassurance. You might consider subscribing if you would like more steady conversations like this, where health is explained slowly and kindly. And if you know someone you care about who worries about blood pressure or feels confused by their numbers, sharing this video could be a quiet act of care. You are also welcome to leave a comment and share your experience or questions. This is a safe, welcoming space, and many people find comfort in knowing they are not alone. As we come to the end of our time together, I want you to take a slow breath. Your body is always communicating, and learning to listen does not require fear. It requires patience. You are allowed to take this one step at a time. You are allowed to ask questions. You are allowed to care for yourself gently. Thank you for spending this time with me. Take good care of yourself, and I look forward to being with you again in the next conversation.